Well, country Victorians are facing difficulties in accessing regional healthcare due to COVID-19 measures and border rules between states. Some patients have been forced to go to South Australia for procedures where they're required to self-isolate for 2 weeks prior to seeing a doctor. Quarantine orders have also made it harder for doctors to enter Victoria from South Australia, with many required to self-isolate when they return home from work. With more on this story, Victoria Nationals MP and federal member for Mallee, Dr Anne Webster, joins me now. Dr Webster, thank you for joining us tonight on the show. This is extraordinary. I know you're very passionate about this. You're saying country Victorians are being denied access to essential healthcare due to inaccurate reporting by the DHHS.
Thanks for having me, Gleeson. It's great to be on. Yes, look, it's of tremendous concern to us. In the last month, we've had 3, what the local papers have termed phantom cases of COVID here in Mildura that have actually proven, that have been reported by DHHS and then a couple of days later have been not confirmed to be local at all. I think it's partly around how the processing is taking place, where it's taking place. DHHS is managed centrally in Melbourne and is not here locally reporting. So, you know, there are issues around the insecurity and the anxiety that causes the community, let alone, obviously, Minister Wade in South Australia, who is denying exemptions for these doctors. I think, just a bit of background, 9 specialists normally come into Mildura to provide procedures and services to patients, and they have not been given exemptions because of the potential outbreak here in Mildura, but they have been given exemptions for Broken Hill. So it makes no sense to the locals. It certainly makes no sense to the CEO of the private hospital who contacted me about this issue.
Well, and full marks for exposing this, because once again, it shows certainly the perception of the disparity between what people in urban centres receive when it comes to healthcare and what those receive in regional and rural areas. And I think that's an issue that all federal MPs representing the country and representing the regional areas are very frustrated about right now.
Extremely frustrated. It is something that I've been declared exactly 12 months last week, which has been a very exciting year, as you can see by all of the news over this last year. It's been unprecedented. I think it's a word that's been used so many times. And the disparity between urban and regional healthcare is something that is very close to my heart. My husband has been in general practice here in Mildura for 42 years, so we have seen the coming and going and the lack of GP workforce in the regional centres. And it's of great concern that at this point in time, where people are waiting for procedures and for surgery, they are expected now, I'm being told, including dental work, that they may have to wait 1 to 2 years for the catch-up to take place. And one particular case was brought to me today. A woman wrote to me and she said, my 78-year-old mother has early onset dementia. She needs cataract surgery. And for her to go across to Adelaide and isolate for 2 weeks and then have surgery it exacerbates an already very complex situation. So it's just absolutely not fair. And the concern that I have is that this policy around no exemption is based on information that is coming out of Melbourne, which denies the 550-kilometre distance that we are to Melbourne, and the fact that we've had no cases for some time.
Yeah, extraordinary, absolutely extraordinary. And I know you've taken this up with Greg Hunt, the Federal Health Minister, and he's shot a letter off to the South Australian Health Minister to try and establish that. Just before we go, Anne, how's the morale in your electorate? You know, it's been a tough time, and I know country folk are resilient and so forth, but, you know, we've had drought, and I know that you've introduced some measures in recent days in relation to that, but just the post-COVID economic recovery out there, how's it progressing?
Look, I think if I look at Mallee, I have 12 shires in Mallee, 82,000 square kilometres. Obviously, there's a lot of diversity across the entire electorate. There are some areas and some sectors that are doing actually very well, some agriculture that has not really been heavily impacted other than perhaps supply chains. But there are other smaller businesses that I am very concerned about. And in Mildura, for example, we have 1 in 14 people here who are actually on job seeker. So when they come off that, we need to make sure that they are in training that can upskill them to another job if their previous job is not available. So there's a lot of work to be done, and I'm sticking close to the ground to hear what people are needing.
Dr. Anne Webster, thank you for joining us tonight. Really appreciate your time. See you soon.
It's a pleasure. Thank you.